Hi! It's a new week and a new video from me. How is everybody doing? Are you worried about the rash on your baby's neck or in the armpit? Or do you have those red bumps on you as well? Is it hot outside? It might be heat rash or in the Philippines, bungang araw. If you want to know more about it and if you want to know how to treat it, keep watching. Heat rash or prickly heat or bungang araw. So, heat rash can be found in everybody. It is especially common in babies. Can also be found in some adults. It is commonly found in areas with hot and humid weather. What happens? So the pores get blocked. So the sweat cannot go out and evaporate. This leads to inflammation with redness and swelling, which leads to the appearance of a rash. So how do you recognize it? In babies, it is commonly found in the neck area, the shoulders, the folds of the elbows, the armpits, or the chest. In adults, it is also common in areas of the skin folds where the clothes touches the skin, causing friction. So, there are a few types of heat rash that I will tell you about, and these depend on the severity of the heat rash. The mildest type is Miliaria crystallina. So, these appear as clear fluid-filled bumps that break easily. The next kind is Miliaria rubra. From the name rubra, it appears, as you can see, some redness. It is also itchy, and there is some prickling or a little bit of pain. The third type is Miliaria pustulosa. So there is still redness, and underneath those bumps are some pus. And then the most severe type is Miliaria profunda. So it is deeper, it goes deeper into the dermis with redness, and then the skin appears like goosebumps. So what are the risk factors of getting a heat rash? First of all, it's the climate. So if you live in an area with hot weather, you are most likely to get it. The next one is the age. It is commonly seen in babies, especially in newborns. Another thing is the physical activity. So if you do a lot of activities that make you sweat a lot and you wear clothes that does not make the sweat evaporate easily, you're most likely to get it as well. And the last thing is if you're obese. This is because of a larger area of skin-to-skin contact that causes friction and also sometimes would block your pores. So what causes heat rash? Like in newborns, heat rash is caused by the immature sweat glands. This is because their sweat glands have not yet fully developed. They break easily, and these traps the sweat. Another thing is overlayering. So if you use a lot of layers or dress too warmly. And also prolonged bed rest. This is because your skin frequently rubs on the surface of the bed and sweat cannot evaporate. And also with the use of heavy creams and lotions that clog pores. How do we prevent heat rash? Well, first of all, keep yourself cool. So use an electric fan or an air conditioner to keep yourself cool. Avoid tight-fitting clothes, wear loose clothes, and those of lightweight fabric like cotton. And keeping yourself hydrated would help a lot. So how do we treat heat rash? For mild cases, they usually resolve on its own if you just keep your skin cool. And you can also have some cold bath and keeping the skin dry. Avoid the use of oil-based creams or lotions because these clog pores. And for itching, you can use calamine lotion. When should you worry and go see a doctor? When there is worsening of the pain, redness, and swelling, that is something to worry about. When your heat rash is accompanied by fever or chills, and when you feel an enlarged lymph node under the armpit or in the groin, and also when there is pus draining from these lesions, you should worry about those and have an appointment. All right, that's the end. Thank you.
Hi! I hope you enjoyed the video. I am here to provide support and help you raise happy and healthy kids. If you have any questions or if you want to suggest a topic, just type in the comments below. And don't forget to hit like, subscribe, and the bell button to keep posted. Alright?